I am Stephen Ttendo Stephen, and I am a senior lecturer with Mbarara University. An anesthesiologist is a physician who decides to specialize in anesthesia. So he takes the 5 years, does internship, and probably goes to the field and then comes back. And he does the 3 years, depending on how long it takes him. 3 years, sometimes it's 4 years in some countries. And then he does a master's in anesthesiology. Anesthesiologist is, I would probably say we need to change them, because when you think anesthesia, people used to think all you have to do is take them to sleep, wake them up, and that's all. But what we find is that actually an anesthesiologist is a peri-operative physician. In other words, he should understand a patient before, intra, and after surgery. I came across a certain doctor who became my boss after that. But I used to enjoy what she used to do, because she was an anesthesiologist working in Mbarara, and every time we could get issues, we would call her, and then you would see her do something that was unique, and you would see everything turning around in a twinkle of an eye. So I was like, maybe this is something to explore. And that's where my interest came from. So one of the biggest problems we had was nobody could look at it as something that was making sense. So we decided that probably we just have to call people, because those who have tested, they know what it is. We call people, talk to them, and then actually find a way. It's also very unfair if you're a resident in this country that you have to pay for yourself, and yet you do a lot of work. So we had to try and solve many of those problems. And in the process, that's why AGBI, Association of Anesthesiologists of Great Britain and Ireland by then, and I think it was GPAS, and a couple of people came in and said, okay, what if we sponsor these people and we pay for their tuition so they don't have to get scared? And that's where everything started, because a few people came out, and those first people who came out, people started knowing that actual anesthesia is something that is very important, and that's how people started coming. And then government came on. After that, government came on and they gave us a couple of scholarships, because we've received a big number of scholarships from government. Not a big difference, yet a big difference. But the issue is, it's basically, I would call it exposure. But one comes out of need, because we can go back and trace how did the whole process start. It's in the 60s when the British were leaving this country, and then they realized that actually there was going to be a gap. So they said, okay, let's get nurses, let's train them, but they'll be working under the surgeon. So they will be giving the drugs, but the instructions will be coming from the surgeon and all that. And that's how everything started. And that brought a lot of problems, because anesthesia failed to come out for all those years, because it was still working under the surgical department. So there was no need to grow. Secondly, our colleagues, because they've been supporting the service for that time, they found it a little bit unfair. You know, all of a sudden you're trying to show them that, wow, there's somebody who is bigger than you, which isn't the case. Truth be told is that we have to face it. The exposure is not the same. And that is where the issue is. The issue is, it's the exposure. And it's the exposure because this is a branch of medicine. We have to accept that. So if it is a branch of medicine, so these people are trained more at a higher level compared to the other people. And that's where the problem is. How do we work? Because even the anesthesiologists cannot do all the work. But the anesthetic officers are many, and they can do a lot of work. So now the issue is understanding one another. The anesthesiologist is not to look at the anesthetic officer as a nobody, and the anesthetic officer not to look at the anesthesiologist as, who do you think you are? You think that you are the only one who is there. So the science is going to be in understanding how do we reach that middle ground and understand one another. There are several different countries which have worked out very well. And the country that I loved most was Norway. If you go to Norway, you'll be amazed. One anesthesiologist can work in a theater which has like 20 theater rooms, and you'll find all are being run by nurse anesthetists. And there is no trouble. So the issue is, how do we copy some of those good kind of examples that we've seen elsewhere, bring them back home, and then we see how we get our model. If we get the model, we shall move. There is nothing. It's just a simple thing and a simple misunderstanding, which we should get over very fast. Motivation will always come from, it wasn't like, first of all, it's not me, it was a group of people, because associations will always arise because of need. So there has to be necessity. Yes. And truth was, we used to have Uganda Society of Anesthesia, which I was privileged to be a president of. But the question was, if the anesthesiologists, the physician doctors come to, say, for example, a conference, then you have to taper everything to cater for each and everybody. And then it wouldn't make sense. And definitely the forces were coming in. The physician doctors said, no, maybe we need to associate at another level. And that's very fine. If that comes up, it is okay. I would actually warn you that even AAU is about to split. You will very soon have Pediatric Association of Uganda. You will probably even have Cardiac Association of Uganda. And it's a way of growth. It's not like we shouldn't be scared that, this is going to break us down. No, it's growth. When there is necessity, then you're going to move to that level. So it was the necessity that actually drove us. So many people were coming up and the necessity was obvious. And then we had to move. So membership is divided into associate and the real full membership. And a full member is given a certain fee to pay, and an associate is given a certain fee to pay. Members right now, and that's what AAU is working on, is to increase the privileges. And then probably everybody will be thrown onto the board. Because even the 100 members that you say, probably only 40% are members of the association. So it's going to be a tussle. I mean, we're going to work so hard to find out how do we increase membership, because there are advantages once you speak the same language. But members right now, probably the association hasn't yet been there. But if you're a member, you will be considered if there is any chance that comes up with AAU. Say, for example, scholarships. If there is anything that is coming up within AAU, you'll be the first one. I'm sure AAU is offering insurance cover for medical for its members, and a few things that they're going to try and do. But it is all going to be something that is going to develop over time. The issue is, how are we going to get as many people as possible to join AAU? Probably that's going to be the hassle, because then it will be very easy for us. Everything we want to say, as long as we say it, anesthesia is a formidable force. As long as you can speak the same language, nothing can be impossible. The challenges, of course, are many. Associations, for example, they can't just run. They must be financed. So you have to work out a way. The team has to work out a way. How am I going to do it? Two, I've already mentioned to you, how many people can I get onto this board? And if we are many, then we can move. That's also a problem. You don't think everybody is going to believe in the same way. You have issues like those so-called battles, which don't make sense, and you waste a lot of energy in that. So the problems were basically financial, then society around us, because we're being misunderstood, we're looked at as, you want to throw other people around. And then the issue even within ourselves, You cannot convince people that let's do this. But I am happy because I can see the numbers are growing and things are going to change for sure. No question about that. The most important thing is how we have managed to allow people to express themselves. Anesthesia is very interesting, has a whole diversity of people who are coming up in so many different areas, and actually they are leading areas and you're seeing things happen. To me, I feel that's the most important thing. Just as we've said, one of the biggest problems is how do we get on even more people, because this growth would even be faster than we can imagine. I still remember our mission was very clear, to save lives through attaining the highest standard of anesthesia provision. I'm just hoping that we find a way. How do we live that dream? It is a dream that when you think about that statement, it means a lot. And then when you have such a statement, then the question will be, then what are going to be your objectives? Then how are you going to achieve those objectives? Then we set goals for ourselves. If we live with that mission and we see how we are going to make sure that we see that mission come to pass, everything will be wonderful for us because it will cater for each and everything we want. One, for us, anesthesia needs us in numbers. Let's learn to tolerate one another. Let's find a way. How are we going to do it so that we have the numbers? If you have the numbers, each one person will bring a brick and you'll be surprised how a wall will be built in a day. So that is for us. For the people out there, they need to give anesthesia a bit of space. We need to grow and they need to realize that we need to grow and they need to come and help us. And I can tell you, just invest in one anesthesiologist, you will not believe what he will do, he or she will do for you. It will be there. And the population, we have to tell them that we are coming, we'll be there with them. Yeah, because we are the best advocates for them. As soon as you come into the hospital, then an anesthesiologist is supposed to be your advocate, and we have to do that. So we shall be there. Thank you so much, and thank you for allowing me to speak on this day. Thank you.